and this is All Angles on a Saturday afternoon. Now, pharmacies, malls and warehouse lootings have destroyed countless businesses in KwaZulu-Natal. Mop-up operations have started in the province, but many people face a shortage of medicines and health supplies amid a pandemic as well. So let's get an update now on how Gift of the Givers is getting around to those communities in KZN. We chat to the organization's founder, Imtiaz Sooliman. Dr. Sooliman, good afternoon. Thanks for your time. I mean, we know that you're a very, very busy man. So just to give us an idea of how you are prioritizing areas in KZN at the moment in terms of where you're sending relief and what you're sending.
Good afternoon, Uveka. We're trying to cover basically the entire province, where the looting has taken place, where businesses have been destroyed, where people are in need. And, you know, and the easy way about that is because everybody knows us. So we get calls from all over the province, and it's very specific. There's an old age home here, there's 50 people here, age 75 to 85, they haven't eaten for 5 days, they need assistance. They'll say, we're in a community, we're in a certain area, we live in these roads, there's 50 or 60 of us here, we have no access to food, we can't get, there's no shops, everything is burned. So like that, we've been getting many calls. But we actually started on Wednesday. And we started in Maritzburg because that's our head office, that's our base. And we started with simple distribution of bread and milk. And this distribution of bread and milk is not only to people who couldn't afford it, it is to people who could afford it also. And because there was no access, you couldn't purchase the items, they were not available. And that expanded the next day to food parcels to hospital staff, including doctors and nurses. With a shortage of items, we couldn't have, when the shops opened, medical personnel waiting in queues. Because the problem was that because of no fuel and the strikes and no access, hospitals only had like 2 nurses per ward. And you send them away to go buy stuff, what happens to the hospitals? Then we got calls from hospitals, besides supplying, we've done several hospitals already, supplying food parcels to healthcare workers. But then in addition to that, calls came from hospitals to say, we don't have food for patients. Can you please help us for food for patients? And hospitals drove from Durban to Maritzburg to collect food for patients. So that's another part of the program. Then, of course, the extension to the other areas where the communities are spoken about. We're busy right now delivering food parcels in Mzinto. Our teams are assessing in Isipingo. We've done door-to-door distribution in CBD in Maritzburg, and it's basically food distribution. But what we're saying is we're going to give a full food parcel for a whole month for a family of 5. And the aim of that is so these people don't go back to the shops. So those who go to the shop don't have to wait too long. And, you know, there's things available when they go into the shop.
Yeah. And what about, I know when you first put out the call, these past few days, Doc, it was about cash donations now being sort of easiest for you to deal with because you didn't know how this was going to, how were you going to transport this. We see lots of airlines coming on board as well. So are you opening that up now to people actually being able to donate actual items, or do you still prefer that they do those cash donations to Gift of the Givers?
No, cash donations is far better. Everything is available in KZN. We want to support the local economy. The problem was goods that are collected, it takes too much of time from a logistic point of view. When you buy from companies directly, you get a truckload of items, all palletized, easy to offload, easy to repack, put in parcels and send it away in your trucks. Otherwise, it's too cumbersome to count 3 fish and 2 beans and 1 day, you know, 1 spaghetti. It just takes too much of time. And of course, you're paying transport costs unnecessary. You can buy everything here. It's much easier. And also, one of the other methods we can be using is if a community is very far away, and they have people that are organized. We're busy with that system also right now. People who are organized into groups. We can actually purchase items in those areas, get it delivered to them within a couple of minutes, and they can start the distribution. Because to do this every day, for so many thousands of people to bring in, to pack, to load, and to travel, it's going to take a very, very long time. Yeah. And when are those people going to get help? Last night, I got a call from the Minister of Agriculture, Tokondiza, and we were supposed to meet this morning, but then she urgently had to go to the North Coast. And she said there's 29 areas where everything is burnt, where there's not a single shop standing, where there's no supplies, and all those people need help. There's one more thing I want to mention, and that's a very important one when you started in your introduction. You spoke about the pharmacies and the manufacturing, and a lot of, because 2 major wholesalers, pharmaceutical health wholesalers have been burned down, a manufacturing plant has been burned down, 70 chemists have been destroyed, many doctors' practices have been destroyed, many optometrists' practices have been destroyed. All this requires now medical support in terms of rebuilding and in terms of getting medication towards the hospitals. And we are looking from a medical point of view, what medicines are required especially for public hospitals, and how we can get to them as soon as possible. There's another major task we're looking at, and of course assisting with rebuilding for small amounts of money for small shops.
Well, how are you able to then get your hands on the medication that is needed, Doc? Obviously, you have a lot of the elderly as well, chronic medication that they would probably be needing now. I mean, as it comes towards this time of the month, we're in the middle, but almost at the end. How are you planning to actually help with that?
Well, the good thing is that only one province was barely affected.
Yeah.
We've still got supplies available in 8 different provinces in this country. So, we could buy it from the manufacturers and the wholesalers from different parts of the country. And I've already got teams working on trying to get a list of what medicine is required in the public hospitals. And if you can, and even for the private facilities, that will not be a donation. They would then buy it and pay for it, and we could get it to them, and they can, of course, give it to the people who come there who want medical aid or pay it for cash. So it's going to be a system where you have the public and the private. For public, it's free. For private, they will pay the fee, whatever the cost is, just as a means of us making it accessible and available and doing the logistics of getting the stuff here.
And there are quite a few relief organizations. You are one of the biggest that are out there. You're so experienced with this, Dr. Sooliman. How are you all coordinating this? How are you making sure that, you've given a food parcel, then you don't have Ashraful Aid going to the same place or Rise Against Hunger going to the same place? Are you sort of talking to one another?
We get feedback from the different communities. A lot of organizations concentrate, a lot on the inside in the city centers. So we get feedback from people to say, look, we are here, we are doing bread and milk. And even there's another 100 organizations, we won't be able to cover all the areas at the same time. It's just too much. So we look at areas that haven't been reached. A lot of people are doing basically bread and milk. We look at the bigger food parcels to sustain people for a month. We look at the hospitals. Of course, we provided ambulance workers also with food parcels so they can carry on with their duties. We're also going to be looking at believe it or not, at the SAPs. Because even though they're police, they also cannot access food.
Yes.
We can't have them getting out of the queue to go wait, get out of responsibility and go stand in the queue to get food. And actually, we got called from the top generals to ask if we can assist, and we've agreed to assist SAPs too. It's not because, do it for free. It's because it's a sense of responsibility now. They need it in the front line, and we can't have them going to stand in shops. And the queues right now are very, very long, at all the supermarkets and what's open. So that's another category. Now, all those categories, basically, we're the only guys that do that.
All right, Dr. Imtiaz Sooliman, Gift of the Givers, amazing work as always, right there at the front when it comes to providing that much-needed relief. Well, Gauteng